Welcome to the Africa Public Health Podcast from Africa CDC, your go-to source for information on key continental health security issues. I am your host, Andisiwe Michelle May. In this series, you will get valuable insights from African scientists and researchers as we unpack important public health topics that impact the continent and the latest developments in public health research. To help us unpack the critical role of digital health in disease management and surveillance, we are joined by a prominent digital expert who is spearheading the acceleration of digital transformation and youth empowerment on the continent.
My name is Jean-Philbert Nsengimana. I'm the Chief Digital Advisor at the African Centers for Disease Control and Prevention. So I joined Africa CDC about 3 years ago, and my role was to put in place a digital transformation strategy for the organization to ensure that we are making the best use of modern technology, especially digital technologies, to advance our mission of protecting Africa's health security.
You've held several strategic roles throughout your career. Amongst others, you served as the Minister of Youth and Information and Communication Technologies in the government of Rwanda. How have these roles prepared you for the current position at Africa CDC, and what drives your passion for leveraging technology to achieve a healthier Africa?
A big part of what Africa CDC does is to work with our member states and support them. And I think my background in government gave me a very good understanding of how the public sector works, how the government works, how policies are formulated and how they are translated into practice. And that really comes handy because that's exactly what we do here at Africa CDC. It's not just about putting in place a strategy on a piece of paper. It's about actually deploying that strategy and achieving the results that are intended by the vision that the institution has laid out. So my experience in government, I think, came very, very helpful. During the 6 years that I served in the government of Rwanda, I had the opportunity to go across the continent. I would say I built a network of peers. So whenever we need to consult, to engage, to partner, to collaborate, it becomes very easy for me to reach out to colleagues. But I would say my experience goes beyond government. Previously, before I joined the government of Rwanda, I was in the private sector and in digital health sector, for that matter. Something that really gave me a keen understanding of the technology and business part of digital health, because it can't just be a sector that is driven by the public sector and donors. Increasingly, we see the future of digital health being driven by entrepreneurs, innovators, the private sector, and consumers. So all of that really is important to put together and shape a vision and a strategy that is going to achieve its intended objectives.
From what I've learned reading about your educational background and some of your early work experience with learning programming and getting behind the nuts and bolts of software development, in those early days, did it serve you well to better understand and communicate digital transformation and strategies?
Absolutely. I learned programming and I was really good at it, but I never got an opportunity to practice because I happened to have been part of the first batch of software engineers trained in Rwanda, graduating about 2002. And at that time, my cohort was about the best you could get in the country at computer science. So we were called on to start in leadership roles, to start different initiatives, to digitize, for example, the public sector, provide dynamic websites to ministries. But in my case, I started something called the Rwanda Development Gateway, which was about digitizing information, not just from government, but also from the private sector, putting in place the first online repository of non-government organizations, the yellow pages for businesses at that time. And I was playing more of a management and leadership role. But I think what the training in software development and software engineering gave me is the ability to learn and realize really how fast technology is changing. That pace of change has never relented or decelerated. In fact, if anything, especially recently with AI, it has accelerated.
Changing gears slightly, what are the key components and objectives of Africa CDC's digital transformation strategy?
First of all, we want to really make sure that our primary care systems are digitized. And this is because that's where the need is the greatest. When you move into the other levels of care, secondary, tertiary care, in many countries you find that hospitals, referral hospitals are more or less served. They are connected in one way or the other. So that's not where the biggest need. And primary care serve close to 80% of our people, if not more. So we said, let's really focus on primary care. And the aim is to leverage digital tools to strengthen service delivery, improve access, affordability, and quality of care. This will include things like digitizing patient records and integrating systems to better monitor and respond to health needs at the grassroots level. The other important priority is on digital workforce development. You can throw any amount of tools and technologies at people. If they are not prepared and skilled to use them, the difference won't be felt. In fact, those tools and solutions will join what we call the digital health graveyard, which is a place where you find so many solutions which never got a chance to scale. So there is really a pressing need to build a digitally skilled workforce to drive that transformation that we want to see on the continent. And we are driving a number of initiatives to that regard.
Can you please share what some of those initiatives are and any other strategies in place aimed at accelerating access to digital health?
I would just invite people to pay attention to the upcoming Africa Health Tech Summit, where we will announce a number of initiatives that are going in that direction, including notably the Africa CDC Public Health Informatics Fellowship, which will aim to train the leaders at the very top level. But there are several other programs and initiatives that make sure that the needs from the consumers, just simple, basic digital literacy to use technology. Then we go to the frontline workers at the primary care level to make sure that they are able to use the tools, but not just to use, in fact, to be part of designing those tools so that when the tools are designed and deployed, they really meet their needs. And then moving on to the technical communities and the policymakers. So we have really a strategy that is very comprehensive on developing our digital health workforce across the continent. So the third is on health tech innovation. We are convinced that the only way we are going to meet the needs, the very different needs of a diverse continent, is not trying to identify, the one-size-fits-all kind of solution that a government could put in place. We are convinced that the solutions are going to come from the people themselves, especially the young innovators that we know have the creativity that is needed to respond to the problems that they are experiencing themselves in their context. So we want to help bringing an enabling environment that allows those entrepreneurs, innovators, private sector, investors, the academia to really be part of the digitization process. And then we want to see some of those solutions made in Africa starting to scale from one part of the country to the whole country, from one country to a region, from one region to all regions. I always say I would consider my job as mission accomplished if I see even one health tech unicorn being born, raised, and graduate or exit on the African continent. That's really the magnitude of the challenge. And then finally, we also need to look inwards as Africa CDC, look at how we can become an informatics savvy organization, as we say, building internal digital systems to streamline our operations, improve decision-making, response times, and resource allocation across different departments, but also across our member states.
What challenges have you encountered in implementing digital health solutions across Africa's diverse healthcare systems?
So first, the infrastructure gaps. Despite growing internet penetration in sub-Saharan Africa remains around 50% as of 2023. So that means that there is another 50% that still lacks access to the internet, which limits the reach and use of digital health tools. Furthermore, only 28% of health facilities in Africa are estimated to have reliable electricity, making it really difficult to sustain health IT systems. So when I talk about primary care digitization, that's essentially the kind of gaps that we are aiming to bridge so that there is a foundation on which digital health can build across the continent. The second challenge has to do with the workforce or digital literacy broadly. So while the mobile phone penetration is high and still growing, the population that own a smartphone in Africa remains low. So in rural areas, particularly, the skills gap is a barrier to effectively use digital health solutions. So training professionals to effectively use these tools is a priority for Africa CDC. And as I mentioned previously, really a priority in our digital health workforce development initiative. The third is something that anybody who's been part of digital health conversation know. It's a bit of a tongue twister. It's called interoperability. And that refers to the fact that across the continent, you often see digital health systems fragmented and incompatible, which makes it really challenging to create cohesive data sharing environment. So for example, less than 30% of countries in Africa use national health information systems that are interoperable across public and private sectors. So addressing this requires investment in creating an open and standard-based platforms and setting regional collaboration frameworks for data sharing. And finally, there are still regulatory barriers in Africa. A good example is during COVID, when you look across the rest of the world, telemedicine grew at about 4,000%. So that's a 40-fold increase. But in Africa, where you would have expected that telemedicine would grow because that's where brick and mortar infrastructure is lagging behind, telemedicine grew only by 300%. So that's a threefold increase. And part of the culprits for that situation is the fact that each country in Africa has its own regulatory framework, many of which are outdated and not designed to accommodate digital health innovations. This often leads to delays in approval and adoption of new technologies. So Africa CDC is working on harmonizing regional data health regulations and data governance standards to streamline processes and promote wider adoption of their solutions.
Now, applying new technologies to address challenges in public health is not a new phenomenon on the continent. Can you share any lessons learned in the implementation process of strategies to overcome some of these challenges?
There are a couple that I can think about. Of course, we are talking about innovative use of technology and especially mobile technology. Some of the examples I'm thinking about are in the domain of integrated disease surveillance and response. I would invite people to check something called the pandemics that didn't happen, which really is a reminder that if these technologies can be well used, disease threats can be captured early on before they become outbreaks, and outbreaks can be contained before they become epidemic, and then epidemics also brought to under control before they become pandemics. So a remarkable example is the Lassa fever outbreak in Ghana. The preparedness had involved making funds available for emergency use, and there is an approach called 717, which is the ability for a health system, a country, to detect a threat within 7 days, notifying within 1 day, and responding within 7 days. So that approach allowed the country to prevent a full-scale epidemic by isolating and treating an infected health worker. So similarly, in Somalia, rapid action on dengue fever, aided by community volunteers and public health experts, aided to contain an outbreak within days. And those are some of the threats that could have become a huge public health burden and economic burden, as we know, but those were contained. Unfortunately, these are the kind of examples that are not talked about in media because precisely they didn't happen. So if we could have more attention to communicating the success stories of containing this kind of health threats, more than publicizing those threats that have manifested. I think that can go a long way encouraging the health workers on the front lines that are doing a remarkable job and using technology to do so.
I really like the idea of the pandemics that didn't happen. And you also touched on the role of technology in pandemic preparedness and response. What are the lessons learned from recent health crises like the COVID-19 pandemic? And how can these be integrated into Africa CDC's current strategies?
There are so many lessons that we learned as a continent. First of all, the first one was when such a disaster strikes, everyone will first struggle to meet their needs before they help others. So Africa has been at the beginning of the pandemic on its own, and it was a big lesson because we realized that we had no infrastructure to produce supplies, PPEs, and later on vaccines and therapeutics. One big lesson that we've learned is we need to build that capacity in-house on the continent, and that has resulted in many different initiatives in the area of local manufacturing. But even when it comes to procuring some of those products and supplies from outside the continent, it doesn't help if every country goes alone. We know the economics, and we know that Africa is only strong and competitive if we come together as a continent. So there has been several initiatives in terms of pooled procurement of different products and medicines and therapeutics and vaccines that we need as a continent. So that was really a big lesson. The other big lesson is information is key. You can't respond to an outbreak or a pandemic if you don't know how to direct your efforts, prioritize, and target your interventions when they are the most effective. So as a result, during COVID, we saw many public health organizations putting in place dashboards, for example, to be able to visualize the information. But I think it starts with data collection. How do we get access, quick, accurate access to the crucial data that we need? And then later on, we can apply analytics and visualization to the data to be able to guide action. The third big lesson is collaboration is key. No one can respond by themselves. Even within countries, you realize that countries that were the most effective in responding to the COVID pandemic are those that were able to harness the combined capacity of all institutions, public institutions, but also involve the private and the NGOs or donors in a coordinated manner. And really be inclusive and remember, for example, that young people, women, and other demographics have a big role to play. So collaboration is just not about governments or public institutions like Africa CDC with development partners or sources of funding. It's really about a whole of society response to this kind of threats.
We've talked a lot about innovative projects and collaborations. Are there any other projects that you are particularly excited about that you would like to share with us?
Our digital transformation strategy, when we launched it in March 2023, that was last year in Kigali, it had 10 flagship initiatives, or those are projects, basically ranging across the 4 domains that I talked about: primary care digitization, innovation, workforce development, and digital transformation for the organization. So we've got about 120 organizations that are partnering with Africa CDC. We built what we called partner working groups, and every one of them is coming up with collaborative initiatives that are at different stage of maturity. And we look forward to launching some of them in the upcoming Africa Health Tech Summit that will take place in Kigali from the 29th to 31st of October. I don't want to break the secret and kill the suspense. We have a couple of things actually coming up in that domain of health tech entrepreneurship. We are launching for the first time a private sector forum because we want to really understand where the tech, big tech, medium and small tech coming up, the health IT industry, what their contribution are from a private perspective. We are looking at the telecom. We are looking at the pharmaceutical industry. People don't associate pharmaceutical with digital, but few people know that the drug discovery, for example, it's all digital and AI powered today, and supply chains are all digitalized. So we are going to be discussing with the private sector, and a few initiatives will be announced in the workforce development domain. We are going to launch a summit, a workforce development summit in Kigali, which will hopefully evolve as a standalone event in the future. And those are collaborations. So that I would say, for example, the health tech entrepreneurship is supported by the Africa Health Tech Hub that is established in Kigali, which has support from the Global Fund, Novartis Foundation, and many other partners. The health tech entrepreneurship is supported by the MasterCard Foundation. I can think about partnerships in the AI domain with Bill and Melinda Gates. Google is on board, several other organizations. We've got Abbott, which is a pharmaceutical, med tech, and digital tech company, a global powerhouse, joining us. So some of those partnerships are already actually announced on the website, but also I think it's important to talk about the partnership with public institutions that have joined Africa CDC on this journey. We are looking at Smart Africa, for example, which is going to launch something called Digital Health Blueprint to see how to leverage public digital infrastructure for improving health on the continent. We're talking about the government of Rwanda as a host government, but several other governments that have been invited to the Africa Health Tech Summit. All those are collaborations that are really going to accelerate the progress towards a fully digitized health sector on the African continent.
As we reach the end of our conversation, I would like to look ahead and get a brief glimpse of the future goals for digital health in Africa.
The future goals is to make sure that healthcare is accessible, is affordable, and is of high quality universally to every citizen on the continent. This is a commitment that the continent has made as part of the Sustainable Development Goals, but also it's a responsibility for governments to make sure, with or without SDGs, this remains a big responsibility of ours. So we want to make sure that people, especially citizens in rural areas, especially children and mothers and young people, have access to the care they need. But most importantly, really leveraging on Africa's unique demographics. We want to see that a lot of effort is put in preventative care, even more than curative, so that we can save, given that $1 invested in prevention saves anywhere between $10 to $12 in treatment. And today, if I take a technology perspective, AI is really coming to augment the capabilities that we've been leveraging over the past decades. So the priority today is to make sure that we are equipped, both in terms of capacities, in terms of technologies, in terms of policies, regulations, investment, really to leverage the power of AI in responding to those priorities, especially at the grassroots level or primary care level. So that's really a big part of our vision. The other big part of the vision is to make sure that the health sector becomes a source of not just better health outcomes, but also economic opportunities, especially for young people. We saw that during COVID. If I cite the partnership that the MasterCard Foundation developed with our institution called Saving Lives and Livelihood, because it became abundantly clear that the health of a society, of a population, is proportionally connected to the wealth, how well they are doing economically. So look at the health sector, especially digital health, as an economic sector as well, and use it to create opportunities for our people, making sure that no one is left behind, and really encouraging young people and women to be part of that change. Yeah, and then we talked about digital skilling. I think it's important that everyone who's in the health sector by 2030 should have the skills that they need to do their work on a day-to-day basis. And that technology has become something that simplifies their life, enables their work, and allows them to do more with less, because we know that constraints are going to still be there. We know that there are problems that we won't be able to solve by 2030. We know that we won't have all the physical infrastructure, roads, electricity, buildings, water, energy everywhere. But we know that digital will be the most distributed type of infrastructure by that time, and making the best use of it would be our top priority.
Thank you for a brilliant and insightful conversation, and you have given us so many things to think about. In closing, do you have any final thoughts you would like to share?
I'm happy to continue this conversation online when the podcast is up and people ask questions and want to interact, and anyone who wants to have a deep dive on any of the topics that I have mentioned. And I would, of course, want to extend an open invite to everybody to join us on the Africa Health Tech Summit. Once again, Kigali 29 to 31st. We've spent 30 minutes, but in Kigali, we are going to have 2.5 days of conversations and many parallel conversations. So basically, the 2.5 days will be multiplied by the number of parallel conversations that are going to happen. We'll have an exhibition to show in practice how these technologies are working and being used to save lives and livelihood across the continent. And we'll have policymakers and private sector and innovators coming together to chart the course for the future. For anyone who really cares about digital health and what it is doing and it can do for our continent, for anyone who's already invested and investing in digital health, for somebody who's considering to do something in that sector, please, this is a must-attend event.
Whether you're an expert in the field of public health or simply interested in learning more, the Africa Public Health Podcast is here to serve as a reliable resource for you. Please get in touch at africacdc.org. Until next time, I'm Andisiwe Michelle May. This is a Volume Podcasts production.